are one of the most widely used treatments across the country and in the metro. Intravenous therapy, or IVs, administer medication and more to help patients get on the mend. Tonight, a local healthcare worker has a warning for patients at BJC facilities. If you need an IV for medicine or blood, this whistleblower says the machines may malfunction.
And they claim that could have serious consequences. Chief Investigative Reporter Lauren Traeger brings us this exclusive story tonight.
Other local hospital systems quickly confirmed to First Alert 4 Investigates what type of IV pump they use. But BJC has declined to answer many of our questions about their pumps. Sources, though, tell us BJC recently started using a new type of IV pump, and there have been complaints to the state and federal government about that new device. Now we're hearing from caretakers who also have concerns about these particular machines. Tonight, one whistleblower says while most patients will not be impacted, there is a potential for risk, especially for people on high-risk medications, and that's why they say they felt they had to speak out.
If BJC were to know my identity, I would lose my job immediately.
This whistleblower terrified of retaliation.
I'm willing to take that risk if it means that I'm keeping my patients safe.
As a care provider with close knowledge of hospital systems, they're more terrified of what they say is a potential danger inside BJC facilities.
Patients should not be being treated with these pumps. These pumps are not safe.
IV pumps are an absolutely critical part of hospital care. They're the machines that carry medicines or blood directly into a patient's veins. Truly life-saving, but only if they work correctly.
They still have the potential to cause great irreversible harm.
And that's exactly what this whistleblower tells us has happened. Recently, they say some BJC facilities replaced their IV pumps, switching from the brand Alaris to the Baxter Novum IQ large volume pump.
It's the Novum IQ infusion platform, giving you the support you need to help save and sustain lives.
Billed by the Baxter Healthcare Corporation as state-of-the-art, the pumps were cleared by the FDA in April last year. But within days of implementing them in BJC facilities, the whistleblower says staff started seeing and reporting major malfunctions.
Do you think people need to be aware that there are issues with this manufacturer?
I do. I absolutely do.
Issues, they say, like blood backing up into the tubing, the pump appearing to work but actually administering too much or too little medication, and worse, instances of the pump acting like a vacuum, sucking an entire bag of medication into a patient at rapid speed.
Is that a major problem?
That is a massive, horrifying problem. There are some medications that you can only get at a very specific rate. And if you were to get all of that medication at once, there's no coming back.
BJC will not confirm any of the whistleblower's claims, saying only, quote, due to HIPAA regulations, we cannot respond to any specific patient situation. And though we asked a number of detailed questions, a spokesperson declined to even say what type of pump they are using at which facilities, only saying specifically that no recent new pump technology has been deployed at Missouri Baptist Medical Center, but they would not comment as to which pumps are being used at any other facility. They provided a brief statement that reads, quote, as part of BJC's commitment to innovation that improves patient care, we regularly introduce new technology and do so under strict conditions. Delivering advanced care safely in an environment that supports healing is at the forefront of what we do. But the whistleblower says BJC is well aware of pump malfunctions. They provided us an email sent on March 3rd to staff acknowledging that, quote, there have been issues, saying Baxter is providing additional in-servicing / problem solving.
At this point, has any solution or fix that's been offered been sufficient?
No, they have all been Band-Aid solutions.
And nothing, they say, was wrong with the old pumps.
As soon as, these really horrific events started happening, why were these old pumps not pulled immediately?
Are you scared?
I am scared. We are scared. When a patient starts to not do well, we worry, is something going on with the patient, or is my pump malfunctioning?
Missouri's Department of Health confirms to First Alert 4 Investigates they have received a complaint about the Baxter pumps, saying it will be reviewed and triaged following their normal process. Another brand of Baxter pump called Spectrum was the subject of an FDA alert last month, the company acknowledging an issue that could result in serious adverse health consequences. And last year, Canada warned consumers about a subset of the Novum IQ pump due to the potential for the keypad to malfunction. First Alert 4 Investigates also analyzed an FDA complaint database. Just in January and February this year, Baxter Healthcare reported close to 140 serious issues with its Novum IQ pumps. We don't know where the reports stem from, but the complaints indicate issues like the pump administering drugs at higher than ordered rates, others indicating no flow at all. 6 reports in just 2 months indicated an injury.
I will tell you, I've heard concerns with every infusion pump on the market.
Ricky Chase, a former investigator for the FDA, familiar with IV pumps, says unfortunately complaints against all brands of the medical devices are not unusual.
It's an inherently challenging medical device that, from a design perspective, has not been perfected.
Issues, she says, are often underreported by hospitals generally, but serious overdoses from IV pumps, she says, are not common. Still, if anyone has concerns, including patients, they should report them to the FDA.
Make sure that the healthcare providers coming in and paying attention to the alarm, pay attention to the medication that's being put in there, right? If the medication is all of a sudden disappearing very quickly, that's a problem.
My intent is not to instill fear or cause panic to our patients or their loved ones, but I do want them to understand the risk.
This provider says they do simply want patients to be informed.
And it is such a privilege to provide them care, and I just want them to know that we are fighting for them and we are trying to raise the red flags and do what is right for them.
I spoke with another BJC caregiver who also confirmed some of the issues, lamenting those Baxter pumps, wishing they could go back to the old pumps instead. Now, the Alaris Pump 2 has faced recalls and has their own list of complaints to the FDA as well, but the whistleblower says they've never experienced anything like what they say is happening with the Baxter pumps. We asked Alaris why BJC made the switch, and they said, quote, they do not comment on individual customers. A spokesperson for the FDA got back with us and said, quote, as a general matter, the FDA does not disclose internal discussions it may be having with any particular firm. Now, we reached out to Baxter multiple times but have not heard back. We do want to hear from patients and care providers about this. You can call our tip line at 314-390-5392 or email us at investigates@firstalert4.com. I'm Lauren Traeger. First Alert 4 investigates.
Well, tonight, care providers and patients are speaking out tonight after a First Alert 4 investigation last night revealed safety concerns with IV pumps at some BJC facilities.
Chief investigative reporter Lauren Traeger reports on the official investigation underway as the hospital system works to determine its next steps.
Over the last 12 hours, we've had many people reach out to us, both care providers and patients, who confirm much of what we reported last night. Instances of new pumps at some BJC facilities malfunctioning. BJC declined to provide any additional information to us today, but we have obtained a new email with new details of what steps hospital administrators are planning to take to address the safety concerns.
Patients should not be being treated with these pumps. These pumps are not safe.
A care provider with close knowledge of hospital systems blew the whistle to First Alert 4 Investigates Monday, claiming new Baxter Novum IQ IV pumps have been malfunctioning inside BJC facilities. Issues, they say, like blood backing up into the tubing, the pump appearing to work but actually administering too much or too little medication, and in rare instances, the pump acting like a vacuum, sucking an entire bag of medication into a patient at rapid speed. Our investigation analyzed an FDA complaint database, and just in January and February this year, Baxter Healthcare reported close to 140 serious issues with its Novum IQ pumps. We don't know where the reports stem from, but 6 reports in those 2 months indicated an injury. Baxter Healthcare has not responded to our numerous attempts to contact them. BJC has declined to answer many of our questions, and they have not even confirmed which facilities have the new pumps, though sources tell us they are currently in use at a number of them. Sources also tell us that Barnes Jewish West County Hospital was the first to receive the new pumps back in late October, and within days, staff, they say, started reporting problems. An email sent recently on March 28th to staff there and obtained by us Tuesday says, quote, our clinical staff observed Baxter Novum pumps administering medication and fluid at rates that were unintended, blood backing up into lines, and error messages and alarms during setup setup and administration. The email to West County staff says, quote, these events have not resulted in significant harm to patients, but says further rollout is on pause, saying, quote, this pause is intended to allow Baxter and BJC to determine the root causes of these events. It encourages staff to continue reporting any concerns or events.
Sadly, it's not unusual, I guess I would say. The infusion pump industry as a whole, you will see that.
Ricky Chase is the former director of investigations for the FDA, specializing in IV pumps. She says no manufacturer has perfected a pump design, and she says most new IV pumps do not go through a rigorous and lengthy FDA approval process. Instead, she says they get what's called a 510K clearance from the FDA, meaning the maker says their device is substantially equivalent to a similar device.
What happens is you start out 10, 20, 25 years ago with an infusion pump. Just think about how much technology has changed, right? And that infusion pump gets a 510K on the market. And now it's just a little bit different to the next iteration. And they say, well, it's close enough. So here's your 510K. All right. So then the third one is a little bit different than this one, right? And so it's close enough.
She says that's happened dozens of times over decades, meaning most IV pump designs have not had significant pre-approval review.
There is no pre-approval inspection to make sure they know how to make it. There's no deep dive review of their design control. There's, in most cases, very minimal or no requirement for any type of clinical study to support those.
In fact, on a government database, we learned that the Novum pump, which was FDA cleared through that 510K process in April last year, is made in Thailand in a facility that has not yet been inspected by the FDA. Patients are encouraged to continue to advocate for themselves. If you see something not right about your pump, experts say you should speak up. We have a lot more information about all of this on our website, firstalert4.com. I'm Lauren Traeger. First Alert 4 investigates.
Missouri Senior Senator Josh Hawley reacting to exclusive reporting by First Alert 4 investigates. He says the company making new IV pumps for BJC facilities should be, quote, sued into oblivion if they have harmed patients in Missouri. Now, Chief Investigative Reporter Lauren Traeger has a major update to a story she broke this week.
Monday, we told you that BJC had recently switched out their IV machines at some of their local facilities, but whistleblowers told us those machines were starting to malfunction in some cases, with some reports claiming patients were injured. And now Senator Josh Hawley says he saw our reports and has strong words for the IV pumps manufacturer.
I did see it. I thought it was appalling.
Monday, First Alert 4 Investigates told you that some BJC facilities had started using a new type of IV pump called the Baxter Novum IQ.
It's the Novum IQ infusion platform, giving you the support you need to help save and sustain lives.
BJC has declined to speak on the specifics. Whistleblowers told us about issues like blood backing up into the IV tubing or the pumps appearing to work but actually administering too much or too little medication. After our reports earlier this week, we heard from more providers and patients. One new email claiming a patient suffered a lidocaine overdose in the ICU after the pump administered lidocaine faster than it was supposed to. BJC has said they cannot comment on specific patients because of federal privacy law, HIPAA.
What should patients do? What's your advice to them? Can they contact your office,
Yes.
for example?
Yes, absolutely. Yeah, if somebody's been injured, please contact us. We want to know. We want to help you. If you know a family member or someone else who's been injured, we want to help you, and we will gather all the information we can, and we will help you hold this company accountable.
Senator Hawley says he looked up the pumps maker, Baxter Healthcare Corporation. He's concerned especially the pumps are made in Thailand.
I looked at their SEC filings. This is a company that is worth billions of dollars. They can afford to make a good IV pump.
In just this year, Baxter has reported around 140 serious issues of malfunctions to the FDA, the federal watchdog over medical devices. CBS News reports around 170 workers were cut from the FDA's Office of Inspections and Investigations recently, and the email media has previously used to contact the FDA now defunct, with reports that their communication staff was also cut.
Are you concerned there could be additional harm, though, if the FDA is unable to stand up to corporations making these devices?
No, I'm concerned if these big corporations, greedy corporations, get away with ripping off consumers. I hope these people are sued into oblivion, and they need to come forward right now with a plan to make whole every patient in Missouri and everywhere else for that matter who has been injured.
The senator now vowing to follow up.
We'll absolutely continue looking into this, and thank you for your reporting.
We have a ton more information on these pumps and other IV pumps as well on our First Alert 4 News app. If you have specific knowledge of the pumps or you just want to contact us, you can do so. That information is below. For First Alert 4 Investigates, I'm Lauren Traeger.
Tonight at 10, a major change at one of the region's largest hospital systems. This is First Alert 4 at 10. I'm Corey Stark. Sam has the night off. This after a First Alert 4 investigation earlier this month uncovered significant safety concerns about certain IV machines in use in our region. Chief Investigative Reporter Lauren Traeger joining us now with a major update.
For the very first time, BJC Hospital System is confirming what they are calling deployment challenges with their new IV pumps. Welcome news to the sources we've heard from who were blowing the whistle about these devices.
Patients should not be being treated with these pumps. These pumps are not safe.
That whistleblower concerned about retaliation first spoke out to First Alert 4 Investigates a few weeks ago, raising concerns about the new IV pumps that had just been deployed at some BJC hospitals. Others, too, confirmed problems with the pumps, issues, they said, like blood backing up into the tubing, the pump appearing to work but actually administering too much or too little medication, and worse, in rare instances, the pump acting like a vacuum, sucking an entire bag of medication into a patient at rapid speed.
Is that a major problem?
That is a massive, horrifying problem. There are some medications that you can only get at a very specific rate. And if you were to get all of that medication at once, there's no coming back.
Giving you the support you need to help save and sustain lives.
Our reporting revealed that BJC had recently switched to the Baxter Novum IQ pump. FDA cleared in April last year, but to date, a government database now shows close to 500 reports submitted to the FDA for serious malfunction complaints related to it, including close to 24 injuries. We don't know the location or the severity of any of the complaints. Still, experts warned patients to stay vigilant.
Pay attention to the alarms. Pay attention to the medication that's being put in there, right? If the medication is all of a sudden disappearing very quickly, that's a problem.
For weeks, BJC declined to answer many of our questions. They would not confirm what brand of pump they use and would not discuss any of the purported issues. That is, until now, after we learned that BJC planned to dump the Novum pump. In a statement Tuesday, a rep for BJC wrote, quote, "The initial rollout of the Novum IQ LVP went well, but deployment challenges increased as we introduced the pump at Barnes Jewish Hospital," end quote. Though they declined to answer how many Novum malfunctions they've experienced, a rep said, quote, "There have been 0 deaths associated with the Novum IQ pump at any of our locations." The pump, they say, had not yet been rolled out to St. Louis Children's Hospital, Missouri Baptist Medical Center, or Memorial Hospitals in Belleville and Shiloh. All hospitals, they say, will now transition to another Baxter device called the Spectrum IQ pump. That pump, a BJC representative said, has been used at Siteman Cancer Center since mid-2024. The rep further writing, quote, "We are grateful for the vigilance, expertise, and dedication of our care teams who continue to keep safety at the forefront of all we do."
It's an inherently challenging medical device that, from a design perspective, has not been perfected.
Pump experts tell us all IV manufacturers have their issues. FDA cleared in 2018, the Spectrum pump, BJC says, is used by many other leading hospital systems and has been recognized with awards. But it was the subject of an FDA alert in March for a problem with missing screws in its motors. Still, news of a switch is appreciated for those who had been so concerned about the Novum pump.
Are you scared?
I am scared. We are scared.
BJC also finally answered our questions about why they switched in the first place, saying their old provider, BD Alaris, had notified them that it had planned to sunset or phase out their pump in 2026. So BJC says they launched a thorough review of all pump technology, hosting multiple vendors on site, they say, to demonstrate products to nurses and clinicians, and Baxter showcased their Novum pump. Again, experts tell us no pump is immune for errors or issues, and patients and their loved ones need to be vigilant and advocate for themselves. If you've got information to add or aid us in our reporting, you can email us at investigates@firstalert4.com. I'm Lauren Traeger, First Alert 4 Investigates.
And if you have a tip or something you think First Alert 4 needs to look into, contact 4. You can send tips through email or calling us. That information right there on your screen now and on the First Alert 4 News app.